Hello, my name is Michael Benderly, and my pathology is kidney stones. The two projections that you will be able to see the kidney stones on are the supine abdomen, also known as the KUB, and the upright erect abdomen. First, we want to get the patient undressed and have them put on a gown. Next, we want to ask them two patient identifiers, which would be their first and last name and their date of birth, to make sure it's the right patient. Next, we would want them to remove any body jewelry, which can include a belly button ring. We're going to use a 14 by 17 cassette lengthwise, and we're going to make sure the ID blocker is down. We're going to put our right marker on the downside, so it's not in any way in the anatomy. We're going to push it in. And next we're going to make sure we're aligned with the tube. So to do this, we're just going to move our bucky. Okay. Now that we have that done, we're going to palpate for the anterior superior iliac spine of the crest. We found that, so now we're going to roll up, move our fingers to the top of the crest. We're going to center there, which looks good there. Next, we're going to make sure that his mid-sagittal plane is aligned. There we go. Next, we're going to want to shield our patient. We want to measure, so move your hand there, sir, please. Thank you. When he measures 20 centimeters, include in our exposure factors, large focal spot, to ensure that we have all of the anatomy on the x-ray. We want to simply palpate for the symphysis pubis, just a small palpation. There, we found it. For this projection, we want to open our collimation to a 14 by 17 lengthwise to the part, and we want to leave the collimation open as to not cut off any pertinent anatomy. So next we're going to have the patient take a breath in, blow it out, and hold it out. The next projection that we are going to do is the AP upright abdomen. As you can see, we already have our patient shielded. Next we're going to line the tube to the part. In order to do that, we need to find the anterior superior iliac spine. So we're just going to palpate for it there. Then we're going to roll up with our fingertips and find his iliac crest, top of the crest. And we want to go 2 inches above his crest, because we want to make sure to get the diaphragms on here. So we're just going to come down just a bit there. And then use this. It's like just the next one. We're using a 14 by 17 cassette, lengthwise. We want to make sure our patient is centered to the film. So we're going to feel for his xiphoid tip. Yep, he's lined up there. Sure that we have all the anatomy on there, and a sure way to do this is to make sure that you have light at the level of the axilla, which we do. I'm going to put a right marker. Next we're going to measure. So we'll have you move your arm there. And we're going to measure from where this enters to where it exits. And we're going to measure 21 centimeters. We want to make sure that our collimation is opened up to a 14 by 17 so we do not cut any of the anatomy. Factors, we're going to use large focal spot and all 3 chambers. It was done on suspended expiration.